Tooth wear is actually, it's a loss of the surface of the tooth structure caused from other than dental caries or the bacteria. And what's actually caused the tooth wear? I can simply divide the cause of tooth wear from the 2-3 phenomena. The first one is attrition, the second one is abrasion, and the third one is erosion. What is attrition? Okay, let's talk about attrition first. Attrition is actually, it's a tooth wear from tooth to tooth contact. For example, if you grind your teeth, if you brush your teeth, or if you really clench your teeth, that's attrition. The second one is abrasion. For example, if you use a very hard toothbrush with a vigorous brushing behavior, you brush your teeth real hard, you can get tooth wear very easy. Or some people who like pipe smoking, biting nail, biting pen, you tend to have the tooth wear from this cause as well. And the last one is erosion. Erosion is a little bit complex, I would say, because of the cause of erosion. Erosion is from erode, that's from some chemical dissolution. And where is the chemical dissolution come from? It can come from inside your body, or it can come from outside your body. Outside your body means, you drink pop, you drink soda, or you drink wine. Or some people, they love to drink lemonade. They can cause tooth wear as well. And another factor is come from the patient's, inside the patient's body. I would say it's the internal factor. It's an acid that come from the gastric, come up to your mouth. For example, if the patient has repeated regurgitation or gastroesophageal reflux, that can cause some dental erosion as well. Well, unfortunately, the patient who has tooth wear, they don't have any symptom. Most of the time, they're aware that, or they hear that they have tooth wear because they see a dentist from the regular checkup. We look at the patient's teeth and we notice something changed, then we tell the patient, okay, you have tooth wear. However, get to the certain point, if the patient have some symptom, okay, they mostly come to see us when they have severe tooth wear. And what kind of symptom? For example, they have lost the feeling, they lost the tooth length. They come and say hey doc, I feel like I have very short teeth. Or some patient or some severe case, they feel like their face is really short. What can you do with that? Something like that. And get to that point, the treatment will be a lot more complex than we see the patient at the initial state. Well, there are so many options out there. Whenever the patient has a tooth wear, first of all, I would find the cause of tooth wear. And then if we find the cause, so we can treat the patient correctly. In the past, when I treatment plan the patient, we take a picture and then we programize, put out the teeth or the future teeth to the patient, and then we explain to the patient. And then we realize that, the patient still don't understand what's going on. Then we use a 3D treatment planning for the patient. We plan everything, we show it to the patient. The patient kind of appreciate it and said, okay, this is what's going on and that's what's going to be happen to them in the future. However, still, the patient doesn't really kind of appreciate it, okay, what happened if we transfer the 3D treatment plan into the real tooth or the real teeth to the patient. So we developed the 4D smile analysis or the 4D treatment plan for the patient. After we do the 3D, we actually transfer the whole or all information that we have in the computer and then fit into the patient's mouth. So the patient, they get to actually see themselves, and then they use a mirror and look back and forth, left and right, and they actually start try to speaking, chewing and smiling and see So whenever the patient see this kind of thing inside their mouth, they understand and then they make the treatment success. And then for restoration, in order to build back their smile again, we have an option like filling, veneer, or even crowns. However, it depends on the severity of the tooth wear. If you have minor tooth wear, we can restore with the filling. However, if the severity increase more and more, get to the point that we need to do the crown, and sometimes only one crown or two crowns can't really restore that case. That patient probably gonna need that we call full mouth rehabilitation. That means we crown most of the teeth or all of the teeth, and we have to restore the bite too. That's gonna be a little bit complex, which require many specialties to be involved in the treatment too. For example, filling, we use some material. Like this day, we use resin composite filling, just kind of grind out some of your tooth structure, and then we patch, I would say filling, just patch on the tooth wear, the area that you have a tooth wear. For the veneer, there are so many kinds of the veneer. The resin veneer or the ceramic veneer. I encourage to use the ceramic veneer as a final restoration. The ceramic veneer is a thin, very thin, just like contact lens, patch it to the front surface of the tooth. And the third one is a crown. Whenever you have severe tooth loss, only veneer can't really restore. You have to, grind out all the tooth structure and then cap it, just to make it stronger and higher. Just restore your bite too. Surprisingly, tooth wear can occur in any age of your life. However, when you look at the study, they said whenever you 65 plus year, you tend to have more tooth wear.